Hello, and welcome to the Jefferson Enterprise Preoperative Education Series for Bariatric Surgery. This collection of videos is designed to provide you with important information about your upcoming hospital stay. This presentation is the first in the series and will detail what you can expect as you prepare for your upcoming bariatric surgery. Preparing for bariatric surgery can be a stressful process. So when you've completed your checklist and you finally have that surgery date, it's a great feeling. Once your surgery is scheduled, there are a few things that will take place leading up to your surgery date. This includes starting your preoperative diet, completing pre-admission testing, and preparing for your hospital stay. When you do finalize your surgery date, it is important to be prepared for when you return home after surgery so that you are not stressed out and scrambling to take care of things. Please make plans for childcare and pet care and have backup care available. If there are aspects of your home that may need to be adjusted, such as having a chair available in case you need to sleep in it, be sure to set that up ahead of time. Make sure you have enough food for the various diet stages ready at home. Be sure to make arrangements with your job as well and have a plan in place in the event that you may need to take more time off. In addition, if you have certain dietary restrictions or religious customs that could affect your hospital stay, please communicate this to your bariatric surgery team. By now, you should be very familiar with the preoperative diet, which has been discussed at your nutrition classes. When you are giving your surgery date, you will be told exactly when to start this diet. As a reminder, the goals of this diet are to reduce the size of your liver, as well as prepare your body and mind for surgery and your new lifestyle. This is not a liquid diet. The general diet plan is 2 to 3 protein shakes, 1 portioned meal, 1 serving of fruit, unlimited non-starchy vegetables, and 64 ounces of water per day. Meeting your fluid goals in this diet stage is very important, so be sure to pay attention to how much you drink each day. If you have specific questions, please refer back to your nutrition guidebook or contact your dietitian. Pre-admission testing is another part of the process leading up to your surgery. Pre-admission testing consists of specific lab tests to ensure that you remain acceptable to proceed with surgery. You may get your history and physical completed at your surgeon's office, but sometimes you may be required to see a separate provider from pre-admission testing for this. When someone from pre-admission testing calls you, they will inform you if this is needed. An important part of pre-admission testing will be when you are asked to provide your medical and surgical history and a list of your medications. Please be as accurate as possible. This is important so that you are instructed appropriately on what medications you can and can't take before surgery, as well as for determining what medications you should continue after surgery. Another necessary step in preparing for surgery is the COVID test. Please bear in mind that guidelines are subject to change, but generally speaking, if you're going to be admitted to the hospital after surgery, you will be required to have a COVID test of some sort, regardless of vaccination status. Depending on what type of test is required, please note that you may also be required to quarantine following the COVID test to ensure you do not contract COVID in the time between your test and your surgery. This is for your safety and for the safety of everyone taking care of you. Please follow the specific instructions given to you by pre-admission testing and contact your surgeon's office if you have any questions about this. On the day before your surgery, you will consume a clear liquid diet. This means you can only drink clear liquids, which includes water or enhanced waters such as Gatorade, broth, popsicles, and protein powder mixed with water or ice. It is so important for you to be well hydrated. At midnight, you will no longer be able to eat or drink anything. This is for your safety to make sure that there is nothing in your stomach when you go in for your surgery. Please remember to follow all instructions given to you regarding what medicines you should take the night before your surgery and what medicines you can take the morning of surgery. You may or may not be instructed to do a special wash with Hibiclens liquid or towelettes, also called chlorhexidine gluconate, the night before surgery. If you are unable to obtain Hibiclens, you can use Dial antibacterial soap instead. If this is part of your preoperative instructions, you will be given detailed information and instructions from your surgeon's office. However, if you have any questions or concerns, please reach out to your surgeon's office right away. Remember to follow the instructions given to you by your specific provider. If you were not told about using Hibiclens or chlorhexidine, then you will not be doing this. Thank you for watching. Please be sure to continue on with the next videos in the preoperative education series, which detail what will happen on the day of surgery. Thank you.